the process for bunion surgery would start with an initial consultation, gaining a history from the patient, examining the foot, and then obtaining x-rays to have a look at the positions of the bones. Once the x-rays have been obtained, they will be discussed with the patient, and surgical options, depending on the size of the deformity and associated factors, would be discussed. So surgery involves addressing the soft tissue contractures that can occur across the joints. Depending on the size of the bunion, it also involves either cutting along the length of the bone and pushing it back into the foot, and then putting some screws into the bone to hold it in position whilst it heals. If there is some residual drift of the big toe, a little wedge of bone is removed and the toe repositioned, and then screws or wire placed across the bone to hold it again. That is performed for a moderate bunion. For a more severe bunion, where there is deviation at the joint here, the base of the first metatarsal is removed and the corresponding portion of the bone towards the midfoot, and this allows for very powerful correction of the bunion, which is then brought into line and metalwork placed across to hold it in position whilst it heals. The foot will be painful for the first 24-48 hours, but with anaesthetic techniques, pain is generally manageable, and rest and elevation and ice packs can also help manage pain as well. So following on from the surgery, I would see you back at 1 week and 2 weeks, where the dressings would be changed, x-rays would be taken, and at 2 weeks, stitches removed. You would then be seen back at 6 weeks with a view to discharge.